an orthopedic surgeon from India, an assistant professor working in medical college in India, took a leap of faith and decided to move his career to Germany. In spite of all the uncertainties and hurdles that he did that, and we at DMiNetz International had the opportunity to witness him take the leap and accomplish his path step by step in last couple of years. Now he is working as Assistenzarzt in a hospital in Bayern in Germany after having passed the Fachsprachprüfung. Hello and welcome, this is Deepak Mishra. I'm a doctor by profession, I work in Germany, and this video is brought to you by DMiNetz International. DMiNetz International is a consulting company based in India and Germany, dedicated towards doctors and dentists, international doctors and dentists who wish to build their careers in Germany. And you are welcome to post your questions, your queries in the comment section, and let us know what do you like about this video, what you don't like about this video. If you have specific questions, we will take care of those questions as well. Starting ahead, Dr. Tanuj, how are you doing this Saturday morning?
Hello Dr. Deepak, good morning to you and to all the viewers who are watching this video. I'm doing great. It's a Saturday morning and we are recording this video. It's a free day for me and I'm just having a great time.
Wonderful. You have been working since couple of weeks, right?
Yeah.
How has been the work?
Yeah, the work has been good. I'm learning a lot of things, how we work in a German hospital, how the things work in German hospital, getting acquainted with the language and with the doctors.
All right. So first of all,
experience.
Wonderful. First of all, let me tell you, it is my great pleasure to finally interview you after so many hurdles. Like initially there were problems with visa appointment, then there came the corona restrictions, everything was locked down for so long, and finally you have overcome all the hurdles and you are here. I mean, a couple of hurdles are still remaining, but that also you will overcome with time, obviously. I'm very happy for you.
Thank you. Thank you so much,
okay.
Dr. Deepak. Yeah, the journey was not very easy with a lot of hurdles. First of all, in India, with the language part, then with the visa, it's not very easy and it takes a lot of time to eventually get the visa. And I was a bit unlucky that these corona times were there and I could not travel to Germany as I had planned.
Yeah. When we fixed our appointment for this interview, I sent out a post on my Facebook and Instagram where I have asked people to share the questions that they think they should ask you, because it's not very common that the specialist doctors decide to move directly to Germany from India. So that's why I got some questions. But the most frequent question or the most frequent interest was towards your motivation. Why did you decide to start your career from scratch in Germany?
Yeah, good that people ask this question. Like everyone has a different motivation to start his career or to excel in his career. For me, the motivation was a little bit different than the other people. My son is the motivation that I came to Germany and I wanted to excel. I wanted to give him, I wanted to give him a better life, or so that he lives in a better environment or in a developed country. The usual hurdles that we have in India, maybe he won't have those things. He would have a better life. And concerning me, I always knew that I am a specialist in India. I have already done orthopedic training. I have experience, It's just a matter of a few years or some time till the time I get acquainted with the German system. Once I'm acquainted with the German system, then I will move further. I will excel in my career, that is for sure, because the experience that I have, I don't have to learn the orthopedics right from the scratch. I already know it. I just need to be in a hospital in Germany and start working to get acquainted with the German system of working. Once I have done that, once I am into the orthopedic training part, I already know few things. Few things I will have to learn again. That is no problem, but I already know a few things.
Exactly. I totally agree with you, Dr. Tanuj, because this concept that people think that you have to restart your career from the scratch, it's not like that.
Yeah.
It's never like that. What you have done so far does not go to waste.
Yeah.
It is as you are in the same branch, you're already a specialist, you have already trained for so many years. So that nobody can take away from you. Like immaterial which country you move to and which place you go to. It is the language might be different, the words they might be using that is different, but the things that you have learned is always going to stay with you. That is the same thing that is in all aspects of life. If someone says that, okay, I was in this particular business, I made losses and I went to another business and had to start things from scratch. No, you don't start anything from scratch. You always build. You learn from the previous things, and I totally agree with this idea, and I like this this confidence that you have, that you know the stuff that you have been doing, and whatever that, I mean, the pathway is difficult that you have experienced yourself, and coming months also that you are working here, it will be difficult to acclimatize with that because of the language mostly. But after those couple of years is done, even though if they reduce the residency, not reduce the residency, it is immaterial, because the work that you are doing, people who will be working with you, they will know the work that you are doing. Your chef arts will know what your potential is. So immaterial what your title is, you will be doing the work that you are supposed to do with that experience. So I think this will answer the question, the most frequently asked interest to my post. Okay. So many times our family and dear ones have to pay the price for our ambition and aspirations. That is a fact of life. In your case, can you share something about the thought process of your family towards this? How was the decision to give up a stable career? It is also, once it's a stable career, second is the financial aspect of it. You earn a regular salary from there, and then waste or spend a couple of years doing language, spending time in Germany without salary to eventually land up in a job. So how did they react, or how was the decision making process over there?
Well, Dr. Deepak, I would like to say that these are not easy decisions in life. These are life-changing decisions, from moving from one country to another country and starting all over again. These are not easy decisions. So the same with me. It was not that easy convincing my wife and my family that I wish to do this. But with after some time of convincing, I was able to convince them that okay, we would have a better start, or we already have experience, so we just need to get acquainted with the system, and then things will just fall into place. And I always took small steps at a time. If you try to convince someone for Germany and you say that okay, you learn the language, then you learn for the FSP, you learn all the medical stuff again in German, then you work in the hospital and train yourself again. If you think about all those things at one time, then you will lose the hope. Maybe you will say that are you crazy? What are you saying? But if you take small steps, okay, first you start with the language with A1 level. You just focus on A1 level. Then you go further, and when you take small steps at a time, everything will fall into place. When the times comes for FSP, you prepare for FSP. When you start working, you focus on your working. When you have registered for Approbation or Kenntnisprüfung, then you take Kenntnisprüfung as the main thing. So you have to be focused and take small steps at a time, and everything that will fall into its place.
Yes. The strategy, this is a very interesting strategy that you have to, obviously one has to have an overview of what is the direction that you are going to, but you have to cut the obstacles, the hurdles into smaller pieces and take one step at a time, because the entire thing, the mountain, it's a big mountain. If you try to move it all at once, that becomes very, very discouraging. So you cut the milestones into pieces and then you do one thing at a time. So very, very interesting. Very nice, Dr. Tanuj.
Yeah, thank you.
So, see, the entire thing, what I focus on is motivation and mindset. Okay, because there are many things. The facts that are required, the information that is required, that is everywhere available on the internet. Okay, not just on towards the career in PG, but to any other thing. At this present time, no one can say that I do not know anything or I cannot do anything because I lack information. That is not the case, because information is in plenty available everywhere on internet. What is missing, or what is the difference between someone who makes it and someone who does not make it? The two things, that the mindset that they have, the strategy that they develop, and the motivation that they have to take the effort. Okay, yeah. So that is why my focus is I want to always understand people's motivation and concepts of life. Otherwise, information is available on the internet every time.
Yeah. So I would like to add one thing.
Yes.
You have said about the information. I would like to add that there is more than required information now on the internet.
Yes.
So much information that might confuse you as well.
True. So, that is true.
We should be.
See, so yes, that brings me to the next question. That once you've decided that Germany is the country that you think your future and your wife's career and your child's future will be secure in Germany, will be better in Germany, what was then after this? What was your strategy?
Like the strategy I have already shared with you, that I took small steps, and my strategy was that I should come to Germany and get settled or get acquainted with the system and get acquainted with the German thing in the city life or whatever. Then it depends. When I am settled, then my family, my child can come to me and they grow as well. So it was always important that first of all I get settled. Okay, I came to Germany last year in July. I came to Bayern, and then I prepared for FSP in Bayern from around 3.5 months. November I passed the FSP, and then I went back again to India to be with my family, my wife, for few months. And in the meantime I got the Berufserlaubnis. The job I had already secured, because when I started my FSP training, I applied for a few places, a few positions, and I could get one hospital was interested in hiring me. So I had nothing in paper, but verbally they said that after getting Berufserlaubnis, they will hire me.
Okay. And they did.
And they
hired.
And,
okay.
Yeah,
Good.
Before leaving for India, I got this job contract.
So basically, what was the time frame between you came to Germany and you had a job like confirmation? You came in July, you said, or August, you said, right?
Yeah, in July I came.
Yeah.
In November I cleared FSP,
Mm-hmm.
and the job I had you can say in November I got a confirmation for the job.
So
as well.
within 5 months' time, you passed the exam and you had a job as well. That's
July,
wonderful.
August, September, October.
That's
my
wonderful.
course was till October, and in November I cleared the FSP.
That's wonderful. See, here I would like to mention to the viewers that Dr. Tanuj got so soon, like in 5 months' time after passing, he passed the exam. I mean, that is in itself. We will talk about FSP soon, but within 5 months he passed the exam. He got the job. That does not happen to everyone. Okay, because as I have mentioned right at the beginning, he is already a specialist. So people who who interview him, they know his potential. They have seen his CV. So for him, getting a job was very easy. For freshers, for people who are without experience, it might not be so easy. So that is just a disclaimer here. Do you agree, Dr. Tanuj?
Yeah, certainly. Like I never applied for. I had read on the internet that you apply for around 200 hospitals. You sent around 200 applications, but I sent only around 20 to 30. And out of those 30, I made a mistake. Initially, I applied from India when I was at B1 level. That is very uncertain. So I would recommend to the candidates that when you are in India and at B1 level, better not to apply. When you come to Germany, or at least you have B2, then start applying. And mostly when you are in Germany, because the employer has interest and he is pretty confident that okay, this candidate is there in Germany and he might join.
Yes, correct. Here to this, from my side, I will say that during my consultation, I have told you also that you apply from India for hospitation. So for those things you can apply, but job you don't apply because nobody will give you a job because they cannot interview you. Yeah, hospitation you can apply. And that way you learn to do this application process. But job, no, that does not make any sense to apply for a job from India, because if you could
apply for Assistenzarzt position, apply for hospitation. That is okay.
Okay, wonderful. So I will ask you about the job interview that you had. How many interviews did you have in total, and what were the questions that they asked you during the interview? How can you explain in short? How was the job interview day?
Yeah, I went for 2 job interviews. These both hospitals are sister hospitals. So I went to the bigger hospital. The Chefarzt was a very nice man. He had trained in USA, in UK, and also in India. And when he saw me as an Indian, he was very happy. I don't know why. and it was very surprising for me. The whole interview was in English. Can you believe?
Oh, okay.
We talked around for 45 minutes. He wanted to know everything, from where I come and what I do as an orthopedic surgeon. Then he showed me what kind of surgeries they are doing. It was only about orthopedics and something about myself. Okay, why are you here? What do you intend? So they try to find out, why are you actually in Germany? What is your plan? They would like to know your plan.
Yes.
While talking to you, if you have a concrete plan and if they think that okay, you have something in your mind, you are just not without any reason here, then they take care of it and they know it. Okay, he is the right candidate.
Yes. Again, same thing. Everyone looks for that motivation and that concept. Everyone has to see exactly the Chefarzt here. Even I have done in Germany total around. Because I came as a unexperienced non-specialist, right? So, and since I came in 2014, I have changed like 3 jobs, moved to 3 different hospitals at different stages of my career. So, in total, I have done around 20 to 25 interviews. Around 25 interviews I have done. The number of interviews later reduces. Like initially, I had done 7 interviews for 1 job. Now, after that, I did like two interviews and got 1 job. So, like that, your choices like you become more selective, and then the interview works out. So the questions, and I remember now, as you said, Dr. Tanuj, that the questions that they ask is also like this, that they want to know what is your future plan. They want to know, are you going back to India after you're completing your FACATs, or what is your family status? Is your family coming to Germany, or what is the plan? So what is your plan? Like, people asked me in one of my university interviews 3 years back, that when I said that I was more interested, like I was interested in research as well, and I want to also be a surgeon, because it's a university hospital, there it is expected that this guy does research also and operates also. So to filter out, I saw how shrewd the interviewer was. There was a panel of 5 people, and one of the interviewer asks me that in future, do you see yourself as a head of the department of orthopedic research? Like, we have an orthopedic research, and we have they only do research only. So that was the thing to filter out, that is it possible that if we tell you that, okay, you will not operate at all, but you will become at a university level head of or the research, so will you take that position? Do you see yourself in next years doing that, like 10 years something? So and I did not know first what to answer to that, because I had never, nobody thinks of such things.
That is a very, very long term plan.
Nobody thinks of, I don't know. But then I took it like what you say, a filter out question, basically, that okay, this guy wants me to know, the question is, are you willing to give up surgery for any other reasons? So then I said no, like whatever it is, it has to come with surgery. So I am going to operate, and along with that, if I can do research, if I can do some academics, anything, that is fine, but first and foremost thing has to be surgery. So I understood the question like that and answered like that. They took me for the job even after 2 weeks of deliberation. But then so these kind of tricky question, I would call it. So they come, and there they want to see how clear you are in your mind about your future.
For me, the interviews were mostly about orthopedics, and they just asked me what kind of surgeries have you done, and where do you got yourself trained. But for freshers, it won't be like this. I'm sure.
Yes. See, they will ask you about things that you have under your belt, right? That means if you are an orthopedic surgeon, then they will ask you about orthopedics. If someone is an internist, they will ask about internist. If someone says that, okay, I have no idea about any branch because I've just graduated, then what can they ask, right? I mean, they will ask that, okay, what do you do in your internship? Like, what can you draw blood? Can you put cannula? What cases did you see in your casualty duties? So those things. So whatever you say in your CV that, okay, I have done this, they will ask you about that. Okay. So, okay. One of the next question is that, now that you're working since a couple of weeks in Germany, what differences have you noticed between the system in India and in Germany?
Dr. Deepak, frankly saying, exactly I cannot say what, because I'm still new to the system, but certain things are different. You have the atmosphere in the hospital is completely different as compared to India. Like, there are no relatives staying with the patient 24 hours, and so there is a calm atmosphere in the hospital. Only the patients are there, the relatives come to meet for certain time. Apart from that, it's very peaceful. You just work with peace. You don't have, you have your work is, we have long working time. Like, we start at 7 a.m. in the morning, and it is till 4 p.m. in the evening, and we should be there at around, I go usually at 6:30. I am 6:30 or 6:45 I am in the hospital to start. So the normal working days are like, we have in the mornings we have x-rays and meeting what came one day prior, then we have rounds, and then the usual operations. And apart from that, the thing which is very, very different is, you should know computer skills.
Yes.
You should be comfortable with computer, because everything is on computer. You don't write anything. You just write the medications on the drug chart and morning rounds, 1 or 2 lines. Apart from that, everything is on the computer. When a patient comes in the emergency, that has to be also, the history, everything has to be jotted down on a computer. That is one big difference.
Yes, yes. Here I will like to two warnings, not warnings. One is that the piece that you are seeing now will change as the corona restrictions go away. Okay, so in the I mean, peace as mean because of the relatives. Okay, at present, many hospitals, or most hospitals, have these restrictions that they are not allowing the relatives frequently in the hospital. It's not like that in India. In India, I have worked also for some time, so the relatives have to take care of the patient, so they have to be there 24 hours with the patient. Here it's not like that, but they will come here every day for 1 hour, 2 hour, and then they will bother the surgeon, like the doctor, that they want to talk and they want a regular update. And that communication, because especially for foreign doctors, because of the language, that communication itself is a big task with the relatives every day. Okay. I would rather like to see two patients or write some brief sitting in a computer somewhere than going and talking half an hour to a patient's relatives and answering their long, complicated questions. So that will come to you once the corona restrictions are more like loosened up. That you have to be. Yeah, but the chaos that I have seen in the government hospitals in India, that you will never see. That is correct. That you are true. That is correct. The second thing that I wanted to say about computers. Yes. So. Many hospitals, as you said, that writing this visitor on a paper and medication, many hospitals even use a computer for that also. Like, for example, we have a visitor wagon. In visitor wagon, that's a computer, big computer with the so you have to move that entire computer to every room, every patient's room, and then one person is talking to the patient, doing the dressing, and one person is writing whatever the patient is saying in that and changing medicines on the computer. So that is also computerized in many hospitals. Okay, so the typing skills are very, very important if you want to do things fast, because first, our problem is that first of all, the language is broken, so you don't know what to write, and second, when you think what to write, then you cannot write because the typing skills are not that good. So it becomes a very long, very tedious task. But yeah, you mentioned very important points.
And it takes some time to get acquainted, like to order the blood investigation, to order a CT scan, to write the discharge summary. Everything is on the computer.
Yeah. So one of our Facebook group members asked if your experience in India is going to reduce the duration of your residency in Germany. Do you have any idea about it as of yet?
Well, that is a difficult question to answer. Like, I'm not at that level maybe to answer this question correctly, but what I had planned in India was I come to Germany, get the approbation, then I will apply for recognition of my qualification, this Facharzt qualification in Bayern. And when I apply, then only I can know what, like they will give some kind of answer, that is for sure. When I apply, I get some kind of answer, whether they recognize my whole qualification or 1 year, 2 years or nil. That I cannot say about that at present, only after my application, but I will apply for that is for sure. I have a colleague in this Krankenhaus. He is a lot senior to me. He came from a country not from EU, but in the vicinity. I will not mention the country.
Okay.
He came. He did not go through the Cantonese proofing. He got approbation after FSP, Then he applied for Anerkennung Facharztqualifikation. He got a date to write his Facharztqualifikation.
Yes.
He took 2 attempts, and in the second attempt he was able to pass the Facharz.
Yes.
And
Yes.
in between they asked him 1 or 2 years of working somewhere in the German hospital, like
Yes, and then they ask sometimes about the deficits, for example, like ICU training or such things that are not part of the orthopedics training in different countries. So they ask, and then when you show that, okay, you worked in ICU for 6 months, and so after that means a couple of years, 2-3 years, it can happen, and I hope that happens with you, that you will get an exam and you then obviously will pass the exam.
Like so this something like this Basisweiterbildung common drug is not there in India, so eventually you will have to do this.
Yes.
2 years you will even have to do this, and then later on I don't know what.
Okay, because I have also recently come across one of the colleague here in Northern Westphalen. He did it from Colombia in South America, and he also spent he did 3 years here something. He worked with me for 6 to 8 months, and then he passed his Facharz exam in Northern Westphalen. In orthopedics, yes.
Okay,
yes,
from
yes,
Colombia.
Yes. From Colombia, yeah. Yes, yes. So, all right.
All depends upon the Arztkammer.
Exactly. Everything here, it is so personalized that nobody can say a pauschal, like a thumb rule that, okay, this is going to be like this. For every case, situation change. I mean, every case, there is a different decision. All right. Now we come to a very subjective question. I get many queries where doctors who are little more in age, that means in the 30s, that I say more in age because normal people, I mean, see, the reason I say that average applicants or people who think about moving to different countries are in their 20s, directly after their college, right, directly after their internship. So other people who have first taken the different route, reached somewhere in their careers, and then think about moving to different country, they are little hesitant. Okay, they are little hesitant that should they do that, because as a beginner, one has nothing to lose. Like they are 25, 26, no family, parents pay their bills, and they're fine. They are free like the air. So they have nothing to lose. They choose whatever they want. Even if they waste couple of years, for them it does not matter much. But for people who are in their 30s, they are very reluctant, and I get many queries from such doctors, and they ask me that what should be the pathway for them. This reluctance, this hesitancy, did that burden your thought process also?
To a certain extent, I would say when I was in India, it was always that thing came to my mind, to be honest, that okay, I am a bit late in this process, maybe. And to be honest, I would recommend that when you are young or fresh enough, you start then you have, as Dr. Deepak said, you have nothing to lose. But when you are in your 30s, there should be a strong motivation for you, and you should be willing to come out of that comfort zone, because in late 30s or middle 30s, you get into that comfort zone, and when you are into a comfort zone, then chances of excelling even in India or wherever, they are not that great. So you should be willing to get out of that, because as I came to Germany, I have realized I have got a good lessons and experience that to accomplish anything, you should be able to get out of your comfort zone. And there is never late, because
very,
you
very
have
good
experience.
Point.
The person who is fresh, who has come to Germany, he has to learn everything from scratch. You don't have to learn everything. When you get into your respective field, like if you are in orthopedic, you should be in orthopedic. If you are in internal medicine in India, you should be in internal medicine in Germany. Then after some time, you don't have to learn a lot of things. Everything is there in your head. But
very, very good points, Dr. Tanuj. Very good points. Uh, Moving to the next question is that it's not a question, but do you have suggestions for the new aspirants who are watching this video? You know about this channel, you know that there are many doctors who watch this channel and take the suggestions and advice that we give on this channel very literally and follow their paths. So I'm sure they are looking forward from some advice on from suggestions from you towards this path.
Like for Germany, I can tell that especially for the freshers, you should be motivated first of all, and you should be motivated for a career in Germany. It should not be a 50-50. It should be 100% first of all, because in between, if hurdles come and you think that I cannot do it, or no, and some negative thoughts, then that won't help you. For that, at the beginning, it is very, very important with the language. Language is the key. And I would like to mention one thing which I've seen here. Please give emphasis on your pronunciation, your Aussprache. Because what I have seen in Germany, people coming from India who have trained with private teachers or online, and I'm also one of them. We have a different kind of Aussprache or pronunciation which is not there in German. So you should with language, you should also train yourself with how the Germans speak through YouTube videos and all those things. Because I have seen sometimes patients and doctors are not able to comprehend or not understand you because your pronunciation is not good.
Yes, very, very, very valid points, Dr. Tanuj. I totally agree with that. Here, I would also add to this that about the online courses that they are for a reason, because it makes your life comfortable.
Yeah,
if you're a working professional, you don't have time to visit the actual classes. If you're in India working, you cannot come to Germany for the language. That way, it reduces. It makes your life easier. But then at the end, as Dr. Tanuj said, that you have to learn the Aussprache. First, you have learned grammar, you have passed the exam, you have got the certificates and the application, everything is done. But to actually use that language, the language has to be built up when you are in Germany, or else beforehand via YouTube and everything. Okay, or having sessions with live like German native speakers. Okay, so that way you can build up the Aussprache and all. But the beginning phase, I think that local teachers also, they're fine, because that builds up your grammar and everything, and you can pass the exam, get certificates so that you can send it to the.
Yeah, certainly.
So
from I would like to add that from B2 level onwards, you train yourself with the pronunciation also.
Yes, correct. Very nice. So we are almost at the end of our session. Here I would like to talk a little bit about DMiNetz International. Many doctors who write to me for guidance mention that they already have a consulting company, like they have already registered with some consulting company. And when I say that, okay, you already registered, and then why are you writing to us? They say that, okay, we did not know about DMiNetz International, that's why we did not register. You are with us since a couple of years now, Dr. Tanuj. How did you find about us?
I would like to first of all recommend Dr. Deepak. Whoever in India is looking to come to Germany and he is not 100% sure what is the plan and what is the way, who is a little bit confused, or who are working, who don't have enough time. So I would like to recommend Dr. Deepak. He will take care of all your paperwork. Everything related to paperwork, visa, FSP, appointment, and everything, your application in respective state for approbation or Berufserlaubnis, everything he will take care of. You have to work hard with your German knowledge skills, FSP exams, and all that things.
Thank you, Dr. Tanuj, for this very nice recommendation. I'm sure that people will also take this seriously and not just like an advertisement gimmick, because that is not an advertisement gimmick. Dr. Tanuj speaks from himself. So the question is that we are like online. Basically, most of our functions are online. Okay. And we have personally, even though we know each other from 2019, I guess by now, it's like almost 3 years. We have never met personally, and you have also not met my team because we are located in Mumbai. You were in North India. So, do you find this online thing a hurdle, or did you find anything there was a problem? It would have been better if you could actually meet me or my team.
No, that, to be honest, that didn't make any difference. Like Dr. Deepak was, whenever I had queries, we were in contact. Whenever I had some problem, I could write to him, and he normally answered it pretty soon. So I didn't have any kind of problems. You don't, like in the beginning, I was a little bit, like when I planned for Germany in the beginning, I was a little bit skeptical that I am going through an online and I have not met anyone. You have that fear when you are in India, like.
Yes. Yes, and I totally understand.
But eventually, everything, like he took care of the paperwork and all my queries, like whatever problems I had, sometimes with paperwork, sometimes with Arztkammer, and he took care of all those things.
All right. Thank you, Dr. Tanuj, for such nice words. I'm very, the work that you do, any work that you do work as an orthopedic surgeon. I also worked as an orthopedic resident, the consulting things that we do. Any work where you put effort, you want good outcomes out of it, right?
Yeah.
And when you get good outcomes, you're happy for it. So in this way, I'm very happy that you are satisfied with whatever services, whatever guidance, or whatever time we have spent together. And I thank you for your time for this interview and saying such nice things about me. Many people, I mean, we have other candidates also who have passed in the previously, but they don't, people usually are very camera shy. They don't want to just come out and speak their mind. They say like everything is fine, but then let's not do it on video. So that's why I'm very thankful to you. And I wish you.
Thank you.
Yes, please go ahead. I wish you all the best. I wish you all the best for your career. I wish you all the best for your Kenntnisprüfung, and I hope that your family and your child comes soon to Germany, and all the best for their future as well. Obviously, we are going to stay in touch, but for the video's sake, we are going to conclude this video here.
Thank
All
you.
right, have a nice time.
Thank you so much, Dr. Deepak, and have a great day.